I'm a cosmetic dermatologist and I'm practicing in Mumbai. The name of my clinics is Curated Skin Solution, and I am by qualification a dermatologist but by passion a cosmetic practitioner. So thank you DERMA TV and Torrent and DERMACON for inviting me here and giving me the freedom of speech, because I love to speak. Now when I was asked the topic, and it is because random talk, so I thought that I should address something which is very close to my heart, and which is grooming, overall grooming, and how important that is for doctors. Like, you know, in this conference we have a huge gathering of dermatologists from India and also from abroad. So in general, I think it's very important that dermatologists dress up well, because not only because it's important for our own confidence, it's also important because our patients, they look up to us. When there is somebody entering our clinics, and if we have a good skin, if we have well kept hair or nails, or you are in shape, that of course speaks a lot to your clients. This conference, particularly between last DERMACON and this DERMACON, I have lost around 10 kgs of weight. I know a couple of my colleagues thought that I have even undergone a gastric surgery, but I just want to say that I have not undergone any surgery. I have just lost weight through intermittent fasting, and in intermittent fasting I am not following any particular rule. All I am doing is that I am only taking a single meal, which is dinner. So for all those who are watching this TV, and if you really want to lose weight, then I think the only solution is to cut down on the diet. So in the past I tried like keto and eating small portions, taking certain pills, nothing helped. I also say that I am very lazy. I don't really exercise, so that's bad. I shouldn't be doing it, but that's what I do. So what I did is I started eating a single meal a day, which was dinner for me, which could be any meal for you. So that helped, and I think over a period of 3 to 4 months I've lost around 10 kgs of weight. So that's good. Now coming to skin, which I'm an expert with. So skin starts right for all of us doctors before we actually go to advise our patients. So for me, I'm very particular about my skin. I didn't grow up having good skin. I was not a teenager who had a flawless skin. I was not taught the basics of skincare while growing up. It was more, I remember I grew up in Mussoorie, which is a hill station in North India, and there wasn't much concept of skincare. So for all you youngsters, I think you are really in very good times where you have such amazing products to use on your skin. So as of now, my skincare always is like use a good cleanser in the morning, then I use a serum, then I use a sunblock, which is okay, not really regularly, but I'm very particular about putting a moisturizer. And then on top of that, like today I have put makeup. So but then before that there are 2 to 3 layers of serum and moisturizer which goes in. It's not like you just put a makeup and just dab it on the skin. It doesn't work like that, right? So the skin has to be hydrated, supple, soft, moisturized, and then you just need very minimal touch of makeup. Of course, I love to do eye makeup, lips. That's different, but I haven't put a thick layer of base, and that's where it helps. Now, for those of you who have acne scars, who have pigmentation, remember that night care is the most important part for you. So night, what one can do, you can start by removing the makeup off if you have used a makeup in the day. Even if you have not used a makeup, like guys who are watching this video, it's important that you actually run a micellar water on the face with a cotton. It takes off a lot of pollution. And today in DERMACON, we are in Pune, I live in Mumbai, I have colleagues in Delhi, so of course we need anti-pollution skincare. Right? So that's the first thing, that use a micellar water on cotton and get off the makeup, get off the dirt, off the grime from the face. Next goes is a good cleanser. I'm not going to say which cleanser, in fact I keep trying new ones. I think I'm using something Glownies or Sebamed, something. I don't stick to one honestly, so difficult to name one, but just that because of my skin tends to go dry, I don't use something which has salicylic acid in it. So how much time? Yeah. So you need to use something which just look for some basic ingredients and the texture of the cleanser. It's very important, right? So after I wash my face, then I personally do not use a toner. But if you are somebody who has oily skin, acne prone skin, take a little toner on a cotton and then dab it on the face as well nicely and give it like 30 seconds for it to get absorbed in the skin. The next comes is an elaborate moisturizing routine which I love. So I use retinoids at night. I also use a lot of moisturizer right from my hairline down till the neck. So I think that for us dermatologists, we have to have the best skin, right? Any doctors, any specialty, you know, any film star, any model, any specialty, dermatologists should have the best skin, isn't that right? So I think it's very simple, 5 minutes in the morning, 5 minutes in the night, and I can guarantee that most of the problems on the skin can be taken care of. Now coming to procedures, of course we should try all that on us. I do Botox, not filler really, have done once long back. I tend to do peels at times. I am in love with Q-switch NDX, so I do that kind of once a month. I do facial. I have done threads for my face. I have also done HIFU for my double chin and to get a contoured chin. And I Botox myself very, very regularly. I've been doing that from last 15 years. So please don't shy away if you have to use these procedures on yourself. Why should you? Right? We are the ambassadors of these treatments. And if we do not use these treatments on ourselves, then how could you have conviction in what you are selling to your patients, right? You are the role model for your patients, so that's very important. So this is skin. I think half of the job is done if the dermatologist has a good skin. And I think if one person has to have a good skin, it has to be dermatologist. Dermatologist means good skin, period, right? Next we move on to grooming, because I still have time on my timer, is hair care. Now for hair, you know, as doctors we tend to tell patients that don't color the hair, it's not good, don't blow dry the hair, it's not good. I kind of differ a bit with this because here I can express what I feel. So I do color my hair regularly. I have also done a lot of blow drying, curling, using tongs. I've even permed my hair, right, because in general my hair are very silky, why not? We know what kind of confidence, you know, doing hair or styling hair can give to us. I've also gone ahead and done a hair transplant. So if you see this hairline, I didn't grow up having this hairline. I had this was kind of much behind. So this kind of an inch of hair was never there. So last year I did a hair transplant with a colleague, Dr. Pradeep, and he's done a fabulous job. So this is the kind of hairline which I wanted. So, you know, I can just tie my hair back and, you know, I can still be comfortable with my hair. And, you know, like, in fact, it's hot, so I do feel like tying my hair. Oh, sorry. Yep. So I just wanted a hair which I can tie. I don't have to style so much, and that's what I did with hair transplant, right? Now next comes is nails. I am often told, you know, I know my colleagues, all dermatologists who are seeing this, they know about my nail story. So I have been doing this acrylic nails followed by now gel nails from last 15 years. 15 years I have been doing my nails. Now the question is, have they spoiled my nail? Maybe, I don't care. Maybe they have spoiled, but I'm always going to keep doing this. I'm sure that, you know, I can afford doing my nails. I think there's some noise anyway. So, you know, so groom yourself how you want, you know, what you feel comfortable with. And trust me, this has a lot of impact on your patients, right? I think there is some noise. Should I continue? Okay. Continue? Okay. All right. So we've done the skin care. Now the grooming and you know, the use of nails. You know, I kind of love to do nails, as I said. Now next comes is the kind of dress, perfume. It always feels good if we dress up well. Like you can see, most of my videos are in red color. This is one top which I have worn so many times, I hate to repeat it, but I love this because I feel that I come out best when I wear a red color. So it doesn't matter if there's a repetition, but I love using red color, and that's what I do. It kind of complements my skin and myself. So I think, yeah. So this is a bit about grooming and all for dermatologists, very, very important. Now let's talk a bit about beginners, because in this conference I was asked a lot about which technology one should start with. Right. So this is important. We are going to talk for 4 minutes on this. If you are a beginner, can I have some water? If you are a beginner who is actually starting out, I would suggest, first of all, do not compromise with the type of machines which you are buying, right? Don't fall trap to the cheaper Chinese or this sold on e-mart or online. You need a proper training, you need an understanding of the parameters of the system, right? It's okay if you can't afford one, right? Whenever you will be able to afford, you can then get the technology into your practice. For now, everybody can start with radio frequency and peels, right? Radio frequency and peels both do not need a lot of investment. There's a short learning curve, and you can at least start catering to your patients, who come for pigmentation, who come for warts, right? So start off with getting a good cautery machine, which will cost you somewhere, I think 20,000-30,000 you should get a good cautery machine if you can't afford like an element. And then you can start with peels. Start doing peels. Now peels are categorized typically, there are peels which are milder peels, which are more of party peels. Then there is something called combination or designer peels. And then lastly we have deeper peels, or which are used for specific indications. Everybody can start off with milder peels. Like you could have milk peel, lactic peel, pumpkin peel, pink peel. There are a lot of milder peels. Most of the peels are either gel based, or they are steps which are exfoliation, moisturizing, mask. So start doing that. That's important. Not much investment needed on your part. If you ask me the laser which you should have, Q-switch and laser hair removal are the two most important lasers which every beginner must start with, right? So I repeat, it is laser hair removal. I love the triple technology, but of course I started my practice using diode, then Nd:YAG. Now I have moved to triple wavelength. So once you have the triple wavelength lasers, I think it's very safe. You can cater to more type of hair, darker skins, medium thickness hair, fair. And so these are the lasers. Then coming to Q-switch, the most important laser in my setup, and I call it my, kind of a lifeline, is Q-switch Nd:YAG laser. I'm sure most of you already know that. Now what you need to know is that what all you can do with Q-switch Nd:YAG laser. Actually, you can do a lot with Q-switch Nd:YAG laser. It is a fairness laser. It is a laser to remove tattoos. This is a laser to reduce fine hair on the face. It is a laser which you will be using for brides to lighten the whole body. It is also the laser, if you want to do a treatment which you can be safe, then there will be no downtime. That's Q-switch Nd:YAG laser. If you also want to get into more of bridal care, you will definitely want to have a Q-switch. You are dealing with people who want to have a party or a function tonight, then only thing which I can think of is Q-switch Nd:YAG laser. That's important. Once you have the hair removal laser and you have the Q-switch Nd:YAG with you, then next important is that you get into learning injections, right? Now, traditionally, botulinum toxin and dermal fillers is not a part of your learning, right, in a dermatology curriculum. Of course, a lot of you may be taking interest and learning it otherwise, but this is still not a curriculum, which is sad. But then after you pass out your post-graduation, I suggest that you work with somebody, understand the limitations, understand what a product can do on the face, and start injecting. Start off with a family member or a friend. You can ask a mentor or somebody who is already injecting to guide you. You can also attend these training sessions done by the pharmaceutical companies and learn injections. It will give you a different thrill. It's more like it will put you above certain other people. It's like my race against this voice going on. So learning injectables is very important, right? So let's sum up the whole thing because I have 10 seconds. Grooming is the most important for dermatologists. Weight loss if those who are obese. Hair transplant or any cosmetic surgery, don't hesitate if you have to do. Right, for the beginners, have a laser hair removal, Kyusu Chandiag laser, and learn to do your botulinum toxin and fillers. And all the best. And if you want to reach me, then my Instagram handle is cutis.in, cutis.in, and my website is www.cutis.in. Thank you so much. I sign off.